Robotic surgery is unique because it uses small incisions, and even though sometimes it does take a longer time than traditional surgery, patients do have much less pain and the recovery is much less. We use robotic surgery for hysterectomies, for maybe due to fibroids or abnormal bleeding, for types of cancer, uterine cancer, cervical cancer, ovarian cancer. The Da Vinci system is a robot system from Intuitive company. It consists of 3 different components. The first one's a patient cart, where it's the robot itself. It has the arms, and that's what connects to the patient, to the trocars, or the sleeves that are in the patient's abdomen. The second component is a surgeon console, and it's where the surgeon sits apart from the patient, usually about 10 feet away from the patient, and they control the arms on the patient console. So they're actually doing the surgery with finger control. And then the third component is the vision cart, and the vision cart is where all the electronics are hooked up. So a common robotic procedure that I would do, probably the most common, is a hysterectomy, where the patient would come in, and I typically do 3 small incisions. They're 8mm incisions. Some people do 4 or 5 incisions. And the procedure itself takes about an hour and a half. The patient goes back to recovery room. I have sent patients home after, if I feel like they're good candidates to go home after the hysterectomy that evening, or they stay overnight. It's usually a less than 23-hour stay. So I think that patients should talk to their provider if they have known fibroids or have abnormal bleeding and have gotten an ultrasound, and this becomes, I always say it changes your life. You have to start making bathroom stops to change your tampon or pad, or interferes with your quality of life and your way of life.